So when are you eligible to delay your Part B? Stick around. We're going to be diving into the details of all the special election periods. It allows you to know the employer group size, how big the size of your group is, and who can actually delay their Part B or who has to go ahead and sign up for Medicare Part B when they turn 65. Stick around. I'll be back in just a second to dive into the details of this video. Hey everyone, my name is Kelby Hightower. I'm the CEO of Medicare Hub, and we are diving back into this series video on going over when you're eligible to delay your Part B and really eliminating having no penalties assessed to you and also not having a loss of options. So if your spouse or you are working and able to delay enrolling into Medicare Part B, depending on the size of your employer. We're going to cover that in just a second, what size the employer needs to be with employees. If you're at and below, you need to enroll. If you're at and above, you don't have to enroll. We'll cover that in just a moment. If you're covered under an employer group coverage, that again qualifies underneath the size, but also if you're covered under an employer coverage at a certain size and above, typically you do not have to enroll into your Part B and you're not going to be penalized or subject to any type of loss of options. And then you are covered under a spouse's employer group health insurance plan. So you may be the husband and the spouse is 63 years of age, you're 65 and you're gonna work for a couple more years until she's 65, and then you're gonna retire because your spouse is covered underneath your current employer coverage. So if you're covered under the employer coverage at the right size and above, you're not going to have to do anything. You can actually continue on with your employer-based coverage. Your wife will be covered and there's not a problem. And then if she gets ready to age into Medicare 3 months prior, you're going to have either somebody help you or walk you through the steps of enrolling. We can always do that, or know the steps to do to enroll her into her Medicare. But also for you, you're going to have to enroll into your Medicare Part A and Part B depending on your size. So let's cover some of the special enrollment periods, which is virtually super important when understanding the employer group size really matters. So size matters when it comes to a special enrollment period and the timelines and time frames of when you have to enroll in your Medicare Part A and Part B. And so let's look at those. Employers have 19 or less employees. So you may be working for a small company, a company like us. We have 19 employees or less. We do not provide employer-based plans at our company, but like if we were in a company-based employer with 19 or less and had company benefits for health insurance, and you're working for a company that's 19 or less, employees must enroll into Medicare Part A and Part B of Medicare, or you're going to be assessed penalties for your Part D coverage and also the Part B premium penalty that we just talked about. That's the 10% for every 12 months you don't have Part B. And this is very important. A lot of times smaller groups get this confused. They don't have an HR person that works at the employer. They actually resource that out, and sometimes the HR is not available. The person doesn't ask. They just think, my friend doesn't have Medicare A and B and they work for a company, I'm working for a company, and I'm not going to get on Medicare A and B. But you will be assessed a penalty if you do not enroll into Medicare A and B. So special enrollment periods, when the group is 19 or less, you need to enroll. Medicare Part A and Part B becomes primary, and then the employer plan is secondary. So with 19 or less, the big idea is your Medicare is going to be primary, the employer plan is going to be secondary. So what happens if you don't enroll? Since Medicare should be primary and picking up a portion, it's going to pass through to your employer-based plan. Then the employer-based plan, the insurance company is going to look and say, hey, they're 65 years of age and older and qualify for Medicare A and B. They chose not to enroll. We're not paying but a portion of that. They should have Medicare A and B paying for the other portion. And what will happen is you are left holding the bag when it comes to the cost of that Medicare coverage. So how does this work for employees that are part of an employer group that has 20 or more employers or employees? So if you're part of a group that has 20 employees or more, then the employee can choose to enroll in a Medicare Part A if they need it. And then Medicare Part B, typically somebody does not enroll into Medicare Part B because they don't have to. Now, whether or not you're going to qualify or need to qualify to enroll into Part A gets into some questions about your employer-based plan. That's a lot more detail. A lot of times we just say schedule a time to talk or talk to a licensed agent that knows what they're talking about. We'd love you to reach out to us. We can actually answer these questions pretty easily, but you need to determine your employer-based plan is going to pay first, and then Medicare is going to be in the secondary payer position. And so Medicare Part A has a pretty low deductible if you go into the hospital. So if you have a high deductible plan as an employer-based plan, and it's going to charge you, say, $3,000 for the first dollars out of pocket, then Part A, I would say enroll into Part A. That's a great example of when you enroll into Part A. But if your employer-based plan has a very low deductible, then having Part A is not going to help you, because the deductible could be $500 a year, and then Part A deductible is going to be higher on original Medicare. So the rule of thumb is 19 or less, you have to apply. 20 or more, you do not have to apply. And so let's go over a couple of other important details. A beneficiary may delay Part B if they qualify for disability, and if you qualify for SSDI and you're going to go on Medicare A and B, you can actually delay your Part B, delay your Part A and Part B both if you need to. If the employer group has 100 or more employees, they can delay their Part B. Now, how many people does this apply to? Not a lot, but for you guys it does apply and you're trying to figure out the questions, this is a great point. 100 employees and more, you don't have to enroll into your Part B. You can choose to do your Part A if you want to, if you need to. And again, those are questions usually that you're going to have to ask someone just to make sure. Don't assume that you know and do the wrong thing and then be penalized or pushed out when it comes to your coverage. So the other question that I have that's often posed is, how many days does a person have to enroll into Medicare Part B once their employer coverage ends? So enrolling into Part B, you have actually 8 months. When your employer plan ends, you have 8 months of time to be able to enroll into Medicare Part B. Now, the problem with that is you only have 63 days to enroll into your prescription drug plan. Your drug plan is warranted by 63 days or less. So if you wait 8 months, then you're going to go past the period that you can enroll into your prescription drug plan. And when you enroll into your Part B and then you enroll into a drug plan past 63 days, you're going to be assessed the Part D penalty that's 1% towards the national prescription drug plan premium average, which is usually around 30-something cents or 40 cents a month. But if you've gone for 10 months or 12 months or 24 months or however long without a drug plan, you're going to be assessed a penalty. And so this is why I always say do everything 3 months prior to when you're going to be retiring. So this doesn't apply to you and doesn't get you in a catch where you're paying a penalty. Always apply early for your Medicare Part A and Part B prior to your retirement or prior to turning 65 to eliminate these penalties. So if you have any questions regarding something you may have experienced, I would encourage you guys to be able to schedule a time to be able to call us. You can do that below, clicking on the link and scheduling a time on our calendar. Also, just a reminder for you guys that like a deeper dive into Medicare, we have our Medicare Made Simple workshop that's available to you. It's an on-demand workshop with a guidebook, provides you all the details in a video workshop series and a guidebook that we provide at no cost. Do sign up for that below in the description also. And then stick around, I'll be back soon. Hey guys, one of the main questions a lot of people ask is how do I sign up for Medicare? In this next video, part of our series, I'm going to be diving into all the details about how to sign up for Medicare. Stick around to our next video, I'll see you then.